Hi there, my name is Tristan and I'm a family medicine resident, PGY2 at Queen's University, and I'm at the Peterborough-Kawartha site. So I'm here in Peterborough in the Kawarthas for 2 years doing my residency, and I did my medical school at University of Toronto where I graduated in 2020. And growing up, my dad was a military pilot, so moved around a good chunk growing up. Both a mix of really small bases in the middle of nowhere, so very acquainted to the small town life, and also spending a good chunk of time in Ottawa, in a suburb of a large city, so I've got both experiences there. So why rural medicine? So despite going to the University of Toronto and being at the downtown campus in the biggest urban center in Canada, I always knew I wanted to end up in a small town and just live in a smaller community where you're a lot closer to people and closer to nature, which is something that's really big for me. And I knew I wanted to work somewhere smaller, so I did some different electives and early clinical experiences during summer in some smaller towns outside of Toronto, and just absolutely fell in love with rural medicine there. Partly it's the scope of practice that rural family physicians get to and to some degree have to have. It's not that you're just in family medicine clinic the whole time, but you might work in the emergency department or take care of hospitalized patients. And there's a lot of different avenues that you can pursue in rural family medicine. It's probably one of the broadest scopes of practice that there is, and that scope of practice, the size of community, and being close to what I love to do is what drew me to it. So at the Peterborough-Kawartha site, we're a distributed site of the Queen's Family Medicine program, which is based in Kingston. Now there's 6 residents a year, and I consider that a really good size. And the Peterborough site, I'd consider it definitely more community than rural, but I'll touch on why I sort of chose that for residency in the next question, even though I definitely plan to practice rurally. But we have 6 residents in our program a year here, and honestly, I couldn't speak more highly of my co-residents. They're an amazing crew, and I couldn't ask for a better group to go through residency with, because it's a tough 2 years, and it's really important to have that network of people to rely on for support and teaching each other and learning lots of different things. And we've gone on lots of different hiking trips, camping, hung out together, all sorts of things, and the group that you have to go through residency with makes a huge impact on your experience of the 2 years, and just couldn't speak more highly of them. So. Now, what do I like about my residency program? So, the Peterborough site, as I mentioned before, is a little bit more of a community site. So it's about 80,000 people, but the hospital's probably about 500 beds, and there's only 6 residents a year. So that's what I like about it, is kind of volume of patients seen and the learning opportunities. Family medicine residency is short, and it's helpful to see as much as you can in the 2 years. So even though I know I want to end up in a smaller town than Peterborough is, it's a fantastic place to do residency because of the volume of patients you get to see. You're never on a rotation with another learner, you're never clamoring over people or residents or other fellows or med students even for other experiences, and there's lots to get to see and do here. And the program's also a bit of a mix of the block and longitudinal. So you do longitudinal family, so you have about a day and a half a week of family medicine per year where you follow that, you stay with that family preceptor for 2 years. And then all of your sort of rotations at the same time are in a block format. So I just felt that fit my learning style a lot better, because I love the longitudinal aspect of family medicine, but I do like the blocked sort of learning style to the main rotations. So what family medicine setting do I like best? Kind of hard to say. I don't think I have a distinct one setting that I enjoy the most, and that's what I like about family medicine, especially in a rural setting, is that you kind of have to take on all those different roles. You're not just in clinic, you're not just in the inpatient hospital setting or in the emerge or, doing a long-term care visit or doing home visit. You're doing all of them a lot of the time, which is what I enjoy about it. I think I thrive off of the variety of experiences, and I'd probably just grow bored if I was in any single one of them all day long, even though on their own I love them all. But it's difficult to say I have one favorite one, so that's why I like rural family medicine. So there are a couple different ways that I engage in some advocacy work outside of regular clinical duties. And one of those would be through involvement in the Society of Rural Physicians of Canada. That's a group that is involved with, if you're watching this video, you probably know what they are, but involved in a lot of work advocating for the needs of different rural physicians and rural Canadians, and is very attuned with a lot of the different challenges in that setting. So I've been an active member of that group for many years, and hopefully will continue to be for years to come. And that's one of the ways that I like to help, advocate for the patient population that I'm going to end up serving someday. And another one would be in the Peterborough site itself. I happen to be the wellness representative for our site, or at least for our year, and do a lot of different initiatives around the site to help advocate for the different, wellness needs of residents, trying to both juggle the needs of work and life and going through a rather crappy pandemic all at the same time. So I think doing a lot of different initiatives to help make sure that the people at our site feel supported and, well, and are able to feel well enough in their personal lives to help carry them through their professional ones is something I'm pretty happy to do. What's something I like doing in my free time? Hands down, outdoors. I'm a huge outdoorsman, and if I'm not in clinic, usually the thing I'm planning of doing is getting outside and being able to enjoy nature, whether that's hiking or backpacking, backcountry camping. I'm really big on a lot of backcountry canoeing, so going on multi-day trips to Algonquin or Kawartha Highlands or something like that. So it's great to be in Peterborough, in the home of the canoe, for something, experiences like that, and being able to be close to those sort of different things that I love doing. And one of the interests I have as well, in addition to rural medicine, is a bit of wilderness medicine. So that's one of the things that I've been trying to pursue in my career, of taking a way to, find what I love to do in work and what I love to do in play, and combine the two together. So I certainly plan to locum around for a little bit after residency to try and find kind of the community that's the right fit for me. I don't think you have to settle down right away and pick your community right after you finish residency, and I think it's probably wise to try on a number of different places to see what works best. And I'd like to try and find somewhere, obviously in small town, rural Canada, where I can do a lot of the things I like to do professionally. That's both family clinic, work in the emergency department, inpatient setting. And I'd also like to, find somewhere to live that is just cool. I mean, I want to be able to live where I play and work where I play. And if I can get out and go canoeing after work, or hiking right after work, or on the weekend without having to, make a huge drive or a trip out of it, then that's the life for me. So tips for medical students who are interested in rural family medicine. I'd say first of all is to try and just get as much experience as you possibly can in different varieties of settings. It's hard to know early on what you actually will really like, what you won't like, and what works well for you, what doesn't, and it's hard to know without actually trying out all those different things and seeing what the right fit is. So I know it's easier said than done, but getting as much different clinical experience to draw on, so that when eventually you have to make a decision of where to apply to, where to work, where to locum, you have some of those experiences to guide you a little bit. So getting as much experience as you can in the field just to help give yourself that little bit of confidence is important. And as well, thinking ahead to CARMs. I mean, a lot of rural programs and rural residencies, it's not plastic surgery, it's not ophthalmology. I wouldn't worry about not matching or anything like that. But they tend to be very small sites often with small numbers of residents. So it's really helpful to sort of make yourself known to the different programs. So whether that's being able to actually do a clinical elective in that location, but easier said than done sometimes, or at least reaching out to the chief resident, the program director, someone like that, just to sort of make yourself known so that the programs that you're interested in know that you're interested in them. Because it does kind of matter with a lot of those smaller sites. So do the research early, try and figure out what sites might be right for you, and try and set up things there if you can, and if not, at least reach out and make yourself known.